is the beginning process of a program called Improving the Realization of the Right to Health in Nigeria. We are going to have a 3-day meeting, and today is the Inception meeting. The following 2 days, we will be having a strategy meeting at 3J's Hotel. Today's meeting is for the core group of partners and stakeholders who are going to anchor this program, which is a 2-year program with a number of activities that involves capacity building, advocacy, research and documentation, networking, as well as trying to change the dynamics of how the investments we make in budgeting begin to make concrete impacts on the lives of the people for the realization of the best attainable standards in physical and mental health. So essentially, what we are here today to do is to go through the project, the goals, objectives, the strategies, the activities, so that we have a common understanding of what we are about to do and a consensus on the timing and how we are going to achieve it. Now, this program has a fairly broad outlook, which we shall discuss when we go into the program proper. We are looking at a diversity of stakeholders, so it's not just going to be those of us in this room. You can see we have representatives from all the geopolitical zones. Ekiti State is representing the Southwest, Imo is representing the Southeast, Rivers is representing the South-South, Adamawa is representing the Northeast, Sokoto is representing the Northwest, and I think we got one more person from Abuja, which is also from the Northeast, who's been a strategic partner of the USAID Health Program. Indeed, you said things we could possibly increase the partners so that we can have greater diversity. We are, over the next 2 days, we are going to have representatives of the Nigerian Medical Association. We are going to have representatives of our Association of Nurses and Midwives. We are going to have the Medical and Health Workers Union. We will, of course, have the key stakeholders from the Ministry of Health. We will have stakeholders from National Primary Healthcare Development Agency. We have invited the National Health Insurance Commission. We have invited the media. And of course, we are also thinking of faith-based organizations, women's groups that will join us. So, and in due course, we are also going to have the academia. So we want to have a diversity of stakeholders because we have come to see from the little experience we've gathered over the years that to make change happen, you need as many persons, as many stakeholders as possible, because everybody has something to bring to the table. And once you neglect, and I even forgot the big elephant in the room, the legislature will also be represented. The chairman of the committees on health in both the Senate and the House of Reps will be there. So the idea of what we are doing is that it's not just an Abuja thing. What we are doing will be replicated in Rivers State, in Adamawa State, in Bauchi State, in Ekiti State, in Sokoto, in Imo, so that the nation will literally be on fire with novel ideas of how to make change possible. Not the kind of change on next level we had before, the real change that will make an impact in the lives of Nigerians. Nasarawa is here. I forgot you when I was talking for North Central. Even though we're in Abuja, Nasarawa is still here to take the message across. So, gentlemen and ladies, these are my this is my introduction, welcome address, the opening remarks I have, and then we'll go around the room to take goodwill messages. Everybody will have to speak of, just for 2 minutes, a message of goodwill and solidarity for what we came here to do. So let's start from you. The mantle of Elijah.